In this video, I'm going to explain how your neck and back can cause arm or leg pain. First, I'm going to break down the spine anatomy. Then we'll talk about how pain moves around your body. And finally, we're going to discuss why you may still be in pain even after seeing physical therapy or chiropractic. Pain can linger if we don't treat the source of it. So if this is something that you're interested in, stick around. So let's start with spine anatomy. There's three parts to the spine: the cervical, thoracic, and lumbar, or the neck, the mid-back, and the low back. Now there's 24 bones in the spine. It's easy to remember because just like there's 24 hours in the day, there's 24 bones. And you can break it up into meal times. 7 bones in the neck, or cervical spine, 12 bones in the mid-back, or thoracic, and then 5 bones in the lumbar spine. Now, in between each one of these bone segments, there's a nerve that sneaks out the holes that are created between the bones. Now, these nerves, it's simple. They just go down and they supply our arms and our legs with electricity so that we can move and function. Now, that being said, they can be susceptible to injury because of compression from the disc or inflammation that surrounds the nerve. So let's talk about how pain can move around your body. So first, the neck and the upper back. When one of these nerve roots gets compressed, that can cause pain to be felt close to the neck itself, or can travel down the arm and even into the hand. This is sometimes called radiculopathy or referred pain, or whatever the name is you want to call it. The point is that it's coming from the neck, and that needs to be differentiated. Now in the low back, when those soft tissues between the bones, they compress a nerve or they irritate it, that can also signal a local back pain or pain down the leg, and that's commonly referred to as sciatica. So whether your pain is constant or come and go, you need to find positions, activities, and movements that cause that pain to either decrease overall or to move locations in the body. Pain moving back towards the spine, if that's indeed the source, is a good thing. We call this centralization, or moving back towards the center. Now, I know that's kind of counterintuitive because we tend to think, well, I'm doing this stretch and I'm making myself worse. I hear that all the time. Someone says to me, Chris, I'm doing your stretch and my neck hurts. And my follow-up question is, well, how does your arm feel? If the arm is feeling better, that's a good thing. Keep going. Now let's talk about peripheralization. That's going to be the opposite of centralization. If you're doing positions or activities or movements that is causing pain to go down into the extremity or down into the arm or the leg, that's called peripheralization. We want to stay away from those positions, activities, and movements that are doing that. So to recap, what's most important is that you pay attention to those positions, activities, and movements that are causing pain to either centralize towards the spine, or the ones that are causing them to peripheralize, where the symptoms go away from the spine. Movement largely affects these things. The biggest reason that people can't fully resolve their pain is usually because they aren't hitting that exact pain source. In 2019, the EXPO study came out, and that stands for Extremity Pain of Spinal Source. So I'll break it down. 47% of people that had shoulder pain actually had a source coming from their neck. So if they keep treating the shoulder, they wouldn't fix the problem. They had to go to the neck. If you look at the hip, 71% of cases were coming from the low back. And for the knee, 25% of the cases were coming from the low back. So if you were stuck on treating the knee, you wouldn't solve the problem. You had to go to the back. So let's consider the breakdown. We have cases where there's people that have shoulder and neck pain. Now, sometimes it's 100% a neck problem. And in that case, you need to treat the neck in order to get rid of the shoulder symptoms. In other cases, it's 80% neck and 20% shoulder, where the focus should be on the neck, but you also have to add in some shoulder treatment as well. And then in some cases, it's 0% neck, where it's not the neck at all, and it's fully the shoulder, it's 100% the shoulder, and in that case, the treatment should focus solely on the shoulder. And that same thing goes for the hip. Sometimes that hip pain is 100% due to the lumbar spine. And then other times it's like a percentage where some of it is hip, some of it is lumbar. And then other times it's fully the hip, in which case the treatment should focus on the extremity. But the bottom line is we cannot ignore the spine, even though it doesn't seem like the spine is the root issue. There's so many cases where actually that shoulder, elbow, hip, or knee is caused by the spine. My name's Dr. Chris, and I hope you found this video helpful. If so, please like, comment, subscribe, or follow, because I'm here to help you. Always remember that there is a solution to your problem. If you have yet to find one, you can call, text, or email me. I would love to help you out.